Case Study 2. Contracting one of the most feared diseases in the world today. Imagine being extremely ill with a high fever, a splitting headache, diarrhea, and vomiting. You're also bleeding from the nose, the mouth, and all bodily orifices. The healthcare workers treating you are wearing clothes that look like spacesuits. In 1 week, your chance of survival is a slim 20%. Sounds exaggerated? This is real. The hemorrhagic fever of the highly contagious Ebola virus. In the past 20 years, more than 1,000 cases of Ebola had a mortality rate of 80 to 90%. There is no known drug or cure for Ebola. Marilyn Lahana of Parkmore, South Africa, is believed to have been the first diagnosed victim to contract the deadly Ebola virus. For 3 weeks, she bravely fought for her life in isolation at Johannesburg Hospital, while medical officials desperately scrambled to find the source of the virus. Marilyn Lahana was a nurse working at a private clinic in Johannesburg. Officials believe that she contracted the virus from a man from Zaire, who died at this clinic undiagnosed 3 weeks later. People who had been in contact with Marilyn were checked twice daily for symptoms, but fortunately, none of her family members or friends contracted this vicious disease. Ebola is spread through tainted blood, and the only sure cure is by prevention. Patients with Ebola are kept under strict quarantine. All healthcare workers need to have a thorough knowledge of sterility, asepsis, barrier techniques, as well as the various skills associated with aseptic technique. Saving lives are not necessarily intricate cardio or neurosurgical procedures. In most cases, medical professionals save lives by performing simple routines like washing hands and donning clean gloves. Your and your patients' lives depend on how strictly you follow procedures for sterility and asepsis. Do not slip up.